Hello, my name is Danielle Roldan. I just want to address my paper presentation on anorexia nervosa and atypical anorexia nervosa on my professor for my weight management class, as well as my fellow classmates. So I wanted to begin by introducing my topic and giving some background information. Eating disorders are usually a consequence of an unstable mind and unhealthy eating behaviors. These eating behaviors are categorized by either eating too little or eating too much. Eating disorders can lead to extreme medical conditions due to the severity of their effects on the digestive system. See, our bodies heavily rely on the organs in the digestive system to provide the necessary fuel and key nutrients required in order to function, thus causing a chain reaction in which other organ systems, such as the heart or the immune system, to be affected if this is inhibited in some way. So there are 3 common eating disorders I want to point out, but it's important to understand that these aren't the only eating disorders out there. These eating disorders are binge eating disorder, bulimia nervosa, and anorexia nervosa. Specific causes for these eating disorders are currently still unknown, yet a complex web of genetic/biological, psychological, and social/environmental factors seem to play a major role. In summary, though, it is important to emphasize and understand that eating disorders are medical conditions and they are not a lifestyle choice. Mortality in relation to eating disorders is the highest amongst other mental health disorders. This is possible due to the domino effect eating disorders have on other organ systems, leading to multi-system diseases with severe medical complications. And while there is much to explore and consider when discussing eating disorders as a whole, the primary focus of this presentation will be on anorexia nervosa and its variant counterpart, atypical anorexia nervosa. See, mortality in relation to anorexia nervosa has been increasing by 6% per decade. However, while about 1/4 of these deaths are related to acts of suicide, greater than 50% are associated with intense medical issues, therefore demonstrating how much anorexia nervosa alone stands out amongst the other eating disorders and its ability to take a life. Anorexia nervosa. What is it and where does it come from? Anorexia nervosa is a diagnostic term that literally means neurotic loss of appetite. However, I felt like this simplistic definition didn't describe the illness enough and do the matter justice. So to put it in greater detail and to describe what it means to have anorexia nervosa, I decided to jot down how having it means having an irrational and intense fear of weight gain, alongside an unstable, relentless desire to achieve thinness, with deep concerns about food and a pervasive disturbance on one's own body image. Patients diagnosed with anorexia nervosa have common eating behaviors that apply specifically to their illness. These eating behaviors, or also known as eating rituals, include severely counting calories, restricting calories, avoiding specific food types/groups, only eating during specific times, and waiting prolonged periods of time before eating again. In addition, restrictive and binge eating/purging has also been found to be common practices amongst these types of patients. The Diagnostic and Statistical Manual of Mental Disorders, also known as the DSM, to identify, diagnose, and treat patients with anorexia nervosa. In the fourth edition of the DSM, its criteria on anorexia nervosa is one that most clinicians use and have in mind to this day. That criteria is as follows. It means to have a refusal to maintain a normal weight, a suggested weight cutoff of below 85% of the ideal body weight, a possession of an intense fear of gaining weight, a disturbance in body image, or a denial of the seriousness of the low weight, as well as amenorrhea. The most recent edition of the DSM is at its fifth revision with several changes and updates on the criteria of various mental illnesses alongside anorexia nervosa. The criteria now in the DSM-5 is a refusal to maintain a normal weight. There is now no cutoff number, but you must be specifically below own weight. A possession of an intense fear of gaining weight or persistent behavior interfering with weight gain. A distorted image or lack of recognition of low weight, and amenorrhea no longer exists as a criteria. Previously, the specific causes for the formation of anorexia nervosa in an individual's mental health is unknown, yet it is thought to be a combination of biological, psychological, and social factors. Some biological factors are susceptibility loci, neurotransmitter abnormalities, hormone abnormalities, and results from family and twin studies. Understanding the role that psychology has, it has been stated that those with anorexia nervosa have specific traits or characteristics that contribute to the mental illness. This includes cognitive controlling traits such as perfectionism, alexithymia, low self-esteem, autonomy issues, maturity fears, as well as comorbid psychiatric disorders such as depression. Lastly, the sociological factor and its part to play. Those with anorexia nervosa, especially adolescents, seem to develop an obsession with diets. This comes from viewing those closest to them, such as parents or friends, participating in dietary behaviors. In addition, societal standards of beauty, stressors such as major life events, and cultural, family, and peer influences play a role. Anorexia nervosa and atypical anorexia nervosa. With the fundamentals of the disorder anorexia nervosa established, what used to be considered from the DSM-5 as subthreshold anorexia nervosa, or EDNOS, may now be discussed. Atypical anorexia nervosa is a new term from the DSM-5 that is used to classify patients with all the signs and symptoms of anorexia nervosa except the ability to be considered significantly underweight. Atypical anorexia nervosa can occur in patients who are considered overweight or even obese. Because of their trajectory of weight loss and restrictive behaviors, they are actually considered in a state of malnourishment. Also, in the past, atypical anorexia nervosa was used to categorize other eating-related disorders, which is why it was called other things. However, as stated previously, its usage has been corrected in the DSM-5. And while atypical means aberrant or deviant, atypical anorexia nervosa should not be misinterpreted as being any less serious than anorexia nervosa. The only major difference between the two is that the patient's weight, and while it may be normal, it is still in a state of malnourishment because they're still experiencing the restricting and binging/purging-like symptoms of anorexia nervosa. Conclusion. All in all, anorexia nervosa and atypical anorexia nervosa are two sides of the same coin. Severe medical complications can occur from either, such as hair loss, dry skin, fragility, pneumonia, cardiac death, and many, many more. Prior to reaching some of these irreversible medical complications, upon diagnosis, treatments can be performed. Treatments for anorexia nervosa is recommended to be through a team-based approach. This involves a primary care doctor, a psychologist, a dietitian, and even family. Also, there can be challenges when trying to treat a patient because of their denial for the treatment, seeing anorexia nervosa or even atypical anorexia nervosa as a lifestyle choice, or the fear of the restoration of their normal body weight. However, it is urgent, nonetheless, to treat these patients because of the severe consequence that could cost them their lives. And that's the conclusion of my presentation, so thank you so much to my professor and my classmates for watching.